I welcome Conceptual Orthopedics, this time both surgical postgraduate and orthopedics postgraduate. Surgeons are joining us for the first time, so welcome. And It's a nice day to join because this particular topic overlap the two specialty, as Professor Gopakumar has already told, that it could be a neurogenic problem or a vascular problem, and the both the diagnosis and treatment can overlap with orthopedics as well as surgeons. Thoracic outlet syndrome is a syndrome which, in the exam wise, unlikely that you will get a case of this as a diagnosis, but this is very important for your differential diagnosis. There will be a lot of cases where you will be asked to give differential diagnosis, anything like carpal tunnel syndrome or a cubital tunnel syndrome for neurogenic, or any vascular ischemia, or any venous thrombosis. This can be as a differential diagnosis. So it may not come to you as a short or a long case, or it will be rare. You can never say no, but it rare as a case. But it is a very common question asked in the differential diagnosis. So you need to know about it in your practice. When you're practicing it, it is very important because you will get a lot of pathology where you don't know whether it's a cervical problem, thoracic problem, or an upper limb problem. And thoracic outlet syndrome can confuse all these problems, including your radiculopathy or some shoulder problems, and because sometimes the symptoms can be quite vague around head and neck and nothing specific. So you need to know about this as an entity, that if you have uh, considered all other things, then you need to think of thoracic outlet syndrome. And that's why it is called a diagnosis of exclusion. It is not a first diagnosis. It comes as a differential diagnosis. And then the way to confirm it by taking a good history, physical examination, some provocative test, and few diagnostic tests. And even then, it is a diagnosis of exclusion. So what we'll do is today to go through this so that in the exam and in your practice, you consider in a back of your mind as a possibility once you have ruled out the other pathology. So we'll go through the introduction, the definition, the anatomy, especially the anatomical side. We already mentioned, Professor Gopakumar said, we were so much concerned in the beginning that the whole pathology is from a cervical rib. And over the period, we have realized that cervical rib is quite common in general population, and a very few of them develop a thoracic outlet syndrome. And also vice versa, we'll discuss that. Among the people who have thoracic outlet syndrome, thoracic rib, especially the fully formed rib, may be very uncommon thing. It's not that common. So cervical rib is not thoracic. Cervical rib as such is not that important, even if you find it in your x-rays, because this is a common entity without symptoms. And also, most of thoracic outlet syndrome may not have cervical rib, and we'll come through that. So that's important anatomical thing. So if not cervical rib, then what are the other anatomical things which can cause thoracic outlet syndrome? We will discuss that. So that's the etiology and pathology other than cervical rib. We will discuss that. And then obviously we will go through the history, examination, and investigation, and then the treatment and the complication of treatment, and future, what are new things happening in this area, which will be useful to know as a future research. So let's start with the history of thoracic outlet syndrome. As we said, initially the diagnoses were anatomical. People used to call it cervical rib or scalenus anticus syndrome, or a lot of name was given to this. It was Pete who first coined this term, thoracic outlet syndrome. And as I told you, it is a diagnosis of exclusion. So it is a number of symptoms or a combination of symptoms caused by compression of neurovascular bundle at the thoracic outlet. So a constellation or combination of symptoms, and symptoms could be neurogenic, arterial, and vascular. three things. So it could be pure neurogenic, pure articular, pure vascular, or any combination of these in the thoracic outlet is called thoracic outlet syndrome. That's the definition of currently we define it. So what is thoracic outlet? You need to know that for the anatomist, thoracic outlet is very different than for us as a clinicians. So if you read a book, it can be quite confusing. Some people might say this aperture, the upper aperture of thorax, is actually the thoracic inlet, and a lot of anatomical book will say this is the inlet, and the outlet is here, down where the thorax is finishing. So that may be outlet. People also call this as a superior aperture and inferior aperture. This one where thorax is the cervical spine and structure are entering thorax. But this is not the outlet we're talking about. We're talking about an outlet of neurovascular structure going from upper thorax and cervical spine to the upper limb. So for us, thoracic outlet is here. What is thoracic outlet? It is a anatomical structure which can possibly compress the neurovascular structure when this is going from the cervical spine and upper thorax to outing towards the upper limb. Okay, that's what the clinician definition of thoracic outlet is. So anatomically, what is this thoracic outlet syndrome? So there are a lot of threes in thoracic outlet syndrome. We already said three features: artery, nerve, and venous. Also, anatomically, there are three areas where thoracic outlet can be defined and where the possible compression is there. So first is between the scalenus anterior and scalenus medius, and this is called an interscalenus area, the first area where the neurovascular structure can be compressed. The second area is behind the clavicle or retroclavicle area. It is here, which is behind the clavicle. And third area is behind the pec minor. So this is your pec minor, pectoralis minor. So these are the three common sites from base of neck to the upper thorax where the neurovascular structures are traveling. So base of neck to upper thorax, where the neurovascular structure are going to the arm. So this structure are going, there can be compression at three sites, which can cause a thoracic outlet syndrome. And these three sites are interscalene sites. So between the two scalenus muscles, which scalenus muscle? Scalenus anterior and scalenus medius. Okay. And between these, there can be compression of neurovascular structure or behind the clavicle. So what is behind the clavicle? So there's a clavicle and there's a rib behind here. So that area is called costoclavicular space. So interscalenus triangle, number one. Number two, a costoclavicular space. So that is your first rib. That's your clavicle. And between the clavicle and the first rib, there can be a compromise of neurovascular structures. Okay. And the third is a retrocoracoid, or actually inferior to coracoid, where pectoralis minor coming and attaching it. So it's called pectorominor space. So remember these three spaces. And immediately you should realize from this diagram that if you see the interscalene triangle between scalenus anterior, there's a brachial plexus and there's a subclavian artery coming here. So there is also a subclavian artery here. But subclavian vein, so this is your subclavian artery. The subclavian vein is actually in the front of scalenus anterior. So this is the vein. So in the first area, in the interscalene triangle, there'll be no problem with the venous because it's not coming in that area. Okay, so see, this is your vein, this is your artery, this is the attachment of scalenus anterior here, and this is attachment of scalenus medius here. Okay, so in the interscalenus area, you can have a compromise of brachial plexus and subclavian artery. Whereas in a costoclavicular space or retroclavicular space, you can have compromise of all three: vein, artery, and nerves. Okay. And if there is a cervical rib, which is, as we said, can happen in common people, it attach between these two. either directly as a bony attachment or little bit fibrous attachment. So if cervical rib comes and attached here, where is cervical rib coming from? C7. Yeah, that's why it's called cervical and not the typical thoracic rib. So it's coming from there, either complete or incomplete, and then attaches between these two and can decrease this space and cause a problem, but may not cause problem. It may be a common feature in about 1% of people have it, but not 1% of people have thoracic outlet syndrome. So that's the cervical rib can be attached here. What are the other structures anatomically? See, this is anterior, we said, scalenus anterior, scalenus medius, and in between you got brachial plexus and subclavian artery. In front is the subclavian vein. But just below the clavicle, there is a muscle attached underneath the clavicle. What will be the name of that muscle which is attached under the clavicles? Is subclavius. You come to know about this when you talk about Erb's palsy or brachial plexus. So subclavius muscles. Can you see that? That's the muscle there. So that muscle is there. So that also forming a boundary of it. So what is the boundary of the interscalene triangle where compromise can happen? It can happen scalenus anterior, medius, and the first rib. That's the triangle formed. And what are the structure can be compromised? Brachial plexus and subclavian artery. What about the second space? In the second space, the compromise will be of artery, vein, and the nerves. But the other soft tissue structures coming are number one, subclavius muscle. On top, you got clavicle, then first rib. And here, just where the first rib is attached, just medial to the artery, there's a quite a prominent ligament which is going from a first rib to the clavicle. So what will be the name of that ligaments? Going from a rib to clavicle. So it is called a costoclavicular ligament. Okay, so remember these anatomical structures which can sometime can be abnormal and cause problem of that. And obviously in the third area, coracoid, pectoral minor is attached. And if there is any abnormality or compromised structure, that will attach. Again, in this area, both brachial plexus and artery and nerves are going there. So symptoms may be combination of artery, vein, and nerves. Okay, so that's a very important slides to understand. If you understand this slide, you probably can attempt any long questions or answer any question for the thoracic outlet syndrome. This is the important thing, that the three areas where compromise can happen. Okay, so